Hi, today we are looking at the dot point health promotion based on the 5 action areas of the Ottawa Charter, specifically at dash point 3, how health promotion based on the Ottawa Charter promotes social justice. Now, within this dash point, what we're going to explore is if we had an examination question on this dash point, how you actually link the Ottawa Charter to the 3 action areas of social justice, which is equity, diversity, and supportive environments, and how those 5 action areas actually promote social justice. These health promotion strategies on the Ottawa Charter, there are 2 clear benefits. Firstly, it increases the likelihood of positive health outcomes being achieved, and secondly, it promotes the principles of social justice. Now, if we were to look at a quick recap on social justice that you have already covered in the prelim within year 11, social justice creates the idea that all people are entitled to equitable provision and access to healthcare services regardless of their background. It is the driving force behind healthcare in Australia and the most obvious example of Medicare. And what Medicare provides is free access to hospitals and getting treated in a hospital, such as having surgery in a hospital and having hospital treatment, a bed and food within the hospital. And also it gives all of us access to GP. And a lot of the time that can be free GP service through bulk billing. What to look at here is when we talk about health promotion, these 3 principles of equity, diversity, and supportive environments must be addressed if health campaigns are successful and if gaps in health statuses are going to be bridged. So any campaign that is produced, and remember the Ottawa Charter is the framework for any health promotion, for it actually to be successful, it must link into the 3 principles of social justice. Now today, what I'm going to do is show you a mind mapping grid of how we would answer a question on this area. You'll see that this grid is completely full. However, unable to answer a question on how health promotion based on the Ottawa Charter promotes social justice, you do not need to link developing personal skills to every area of social justice, which is equity, diversity, and supportive environments. What you need to do is create a mind map in how developing personal skills would link to one of the action areas of the Charter when we're answering exam questions in this area. Now, before we go through this mapping grid, we need to familiarize ourselves with the definitions of each action of the Ottawa Charter and also the definitions of social justice. So developing personal skills, and we are looking here on the left-hand side for the definitions, is developing the knowledge and skills of individuals and the allocation of funding and resources. An example of this for developing personal skills is when we go onto websites such as Quit Now and we access quit plans and pamphlets on how to quit smoking. That is developing our personal skills. It's providing us with knowledge and skills on how to quit smoking. Creative supportive environments is making the environment where people work, live and play more supportive. Strengthening community action focuses on the action that communities can take to improve their own health. Reorientating health services is health services have moved away from more traditional approaches of health promotion and doctors and medicine, and they are looking at ways of how they can deliver health information in alternative ways, such as guest speakers going into schools to educate you on a certain topic. Building healthy public policy relates to the decisions made by all levels of the government, and this is in terms of laws and policies. So the government recognises that P-plate drivers from epidemiology data, especially males, are a high risk. So they then create campaigns such as the No One Thinks Big of You and puts that in place. They've also got put in place laws related to P-plate drivers and what they cannot do to ensure that they're safer on the road. When we look at our 3 action areas of social justice, because remember within this dash point, we're linking the Charter to promoting social justice. We have equity, which is the allocation of resources according to the needs of the population. So equity recognizes that there are certain groups in society, such as the Aboriginal population, low SES and rural and remote, that do not have the same resources as other Australians, and therefore more funding needs to go there. Diversity is the difference that exists between people. Australia is a very diverse population, and therefore not everyone could be treated the same. And the last action area is supportive environments. A supportive environment increases the chance of a person being able to make healthy decisions. So that is about creating an environment where people live to make it safe, and they are able to access health information within that environment that therefore improves their chance of having a healthier lifestyle. Notes that you have this table, which is in a lot more detail. So what this table is showing you is how developing personal skills, an action of the Ottawa Charter, supports the principles of social justice. Now, as I said, I have already provided you with a map of how to answer a question and how health promotion links to social justice and linking the Ottawa Charter to social justice. So that is in highlighted in turquoise here. What you'll need to do is read through this grid and give yourself a little bit more insight about how developing personal skills links to each action area. And you can do that in your own time. The most important thing we do is actually refer to a mapping grid. So if you've got a question on this in the HSC, you know exactly what you are going to answer and how. Let's look at how we would answer a question on this dash point. What you'll need to do for a question on this dash point is you'll need to define each action area of the charter. So let's start with developing personal skills, and then how they interlink with a principle for each one of social justice. We have to remember that health promotion is a positive, okay? It's a positive thing. So your examples within this question will need to link back to improving health for individuals for the better. Okay, when we have a question based on Ottawa Charter and the social justice, we are not looking at negative examples and how it doesn't meet it in certain action areas. That's not what the question is asking or the dash point is focusing on. It's focusing on how each action of the Ottawa Charter links with social justice to make it more effective. Mapping grid, we have different examples. So developing personal skills links with diversity, and then you've got the body of your example highlighted in yellow. So the provision of Medicare brochures in different languages means the promotion of health and attainment of knowledge is achieved over language barriers. Breast screening information, what to do and where to go. So that is your example for developing personal skills linking to diversity. You have got a full grid, as I've said, that links to each action area of social justice. But as I've said, you just need to pick one, and I've done that for you here. Creative supportive environments links to very closely to supportive environments. That's always a good one to remember in terms of when we're looking at creative supportive environments where people work, live and play and making them more supportive. We do that through the social justice principle supportive environments. And your example is laws banning smoking in public places supports people's right to be healthy. Strengthening community action links to diversity. So a strong and vocal voice can also be helpful in promoting the need for diversity. An example of this is lobbying for more doctors to rural and remote areas. This improves the level of service and care in rural and remote hospitals. We've all watched Outback ER. That is a great example to show you that there is a need for more doctors and more experienced doctors to go and work in rural and remote areas so their healthcare services can improve. Reorientating health services links to equity, allocation of funding to the ATSI people to help reduce inequity experienced by this group. And we can talk about here when you need to allocate more resources for the Aboriginal population. Why? Because they suffer worse health. What's our example? Our example can be Purple Health, okay? That campaign has been set up and more money has been put into certain campaigns such as Purple Health and Close the Gap, okay? And that ensures that that group of people, okay, their health improves through such campaigns. And when we talk about reorientating health services, we have doctors and nurses that are going into those centres and educating the elders and people working in Purple Health how to actually run their kidney dialysis centre. The last area, building public policy. When we look at building public policy, okay, we're looking at how laws and policies are put in place by all levels of the government to ensure that we achieve better levels of health. And this links to the example supportive creative environment. So developing road safety information that targets specific groups, such as young males. As we know, they have young males in that higher risk group of 16 to 24 have much more accidents, 60% more accidents and deaths in road injuries, and therefore focusing on this group, okay, helps protect the right of people by the roads being healthy and safe. And we can look at, well, what is put in place in environments to ensure that happens. If we look at schools, 40k an hour zones, okay, crossings and lights put in those areas to make drivers aware that there are certain rules on the roads. There's also, for supportive environments, making sure roads are up to scratch in terms, are they safe to drive on? Again, creating a safer environment for drivers and supporting the environment that they live in. Through this grid, and you've made your mind map, we're now ready to answer the question. So for a question on how health promotion based on the Ottawa Charter promotes social justice, you must follow these guidelines. First of all, we need to define the action area of the Ottawa Charter, and you can see the example, okay, here that I'm about to go through. So let's look at creative supportive environments. The definition is improving the area where people live, work and play. Okay, so that in the KEL strategy, that is going into my keywords. Then we're going to go into the body of our example. So if we look above the creative environments, okay, I am linking creative supportive environments into supportive environments for social justice. An example of this is providing outdoor gyms in parks that allows people to exercise for free, thus improving health. This is my example, and the link back, like I said at the very start of this video when we're covering the Ottawa Charter, is to link your examples back to improving health. That's what health promotion does. This action area is closely linked to the social justice principles supportive environments. So I'm clearly identifying the link between the Charter and social justice, which increases the chance of someone making healthy decisions. So I've defined the action area of social justice. Having free cycle lanes in parks and roads will increase the likelihood of people exercising, thus improving their level of health. So again, my example for how supportive environments links into creative supportive environments, I've defined, given an example and linked it back. Now, if I was to do one off the top of my head for developing personal skills, I would start by saying developing personal skills links closely with the action area diversity. Developing personal skills is developing the knowledge and skills of individuals and allocation of funding and resources. This links closely with the action area diversity, which is the difference that exists between people. An example of how these two action areas work together is the provision of Medicare brochures in different languages means that the provision of health and attainment of knowledge is achieved over language barriers. This, therefore, improves health. So you can see I've gone through two structures there. One is a little bit more detailed as I've gone through 2 examples, how creative supportive environments links to supportive environments, or I've put them all into one example. So I've defined developing personal skills and stated that it clearly links to diversity. And then I have defined each action area and given an example for both.